Hello, my name is Dr. Boykin Robinson. I'm a board-certified emergency physician, and I will provide some simple instructions regarding your aftercare. We hope that this instructional video proves to be useful, but please remember that this video does not replace the information provided by your individual physician in the emergency department. It is meant to supplement those instructions. If there are any questions or concerns, please contact the facility that treated you or your private physician. Thank you for giving us the opportunity to evaluate you for your head injury. Head injuries are a very common emergency department complaint, and the vast majority of patients do very well with these injuries and do not have any ongoing problems related to them. Head injuries that involve bleeding in the brain are managed in the hospital and fortunately are very rare. Some patients have radiographic imaging of their brains in the emergency department to evaluate for this bleeding, but most of the time this can be well evaluated with a history and physical exam. Patients in whom we suspect bleeding in the brain are more likely to have a concussion. This is a small bruise to the brain that usually cannot be seen on a CT scan. Concussion is a clinical diagnosis, meaning there are no tests to confirm that a concussion actually took place. Symptoms of concussion include loss of consciousness, dizziness, vomiting, memory loss, and confusion. It is recommended that you avoid contact sports for at least 2 weeks, as there is a slightly increased chance of injuring a brain that has recently been through a concussion. If you have symptoms of a concussion that do not resolve, or if the symptoms are getting worse, you will need to be reevaluated in the emergency department. We consider the first 6 hours after the injury to be the most important time for symptoms to develop, but it is also possible for important symptoms to develop later. It is okay to sleep during this first 6-hour period, but it is important to have someone who can watch you for developing confusion and who can wake you each hour to make sure that your symptoms are not progressing. Thank you for taking the time to view this video. We hope that you found it helpful. Again, follow your treating physician's instructions as your situation may be unique.